Welcome back. Many thanks for staying with us. Now let's talk HIV/AIDS. Now new HIV/AIDS infections across ages, we understand, has gone up by 21%. Government says it is pushing for a more radical approach in a desperate bid to reverse the trend. Charity Emihel Bartels reports.
Figures show a 21% increase in new infections across all ages. These new infections were recorded between 2010 and 2016. Speaking on behalf of the President at the opening of the 2018 National HIV and AIDS Research Conference, Minister of Aviation Cecilia Abanadapa said the situation calls for a radical approach.
Between 2010 and 2016, new HIV infections have increased by 21% across all ages. The growth of new infections in young people aged between 15 and 24 years was even much higher. Having a rising trend in new infections at a time when many African countries are seeing significant reductions in new infections calls for renewed national commitment to HIV prevention, especially targeting the general population in order to stem the tide.
Government, however, says it is putting measures in place to revamp funds of the AIDS Commission and step up the nationwide campaign. U.S. Ambassador to Ghana, Robert Jackson, commended Ghana for being among countries that are working assiduously towards achieving an AIDS-free society by 2030.
For the first time in modern history, we have the opportunity to control a pandemic without a vaccine or a cure. We are laying the groundwork for eliminating HIV. And when we eliminate it, we will enjoy healthier populations and a more secure and prosperous world for us all.
The Ghana AIDS Commission was hopeful with the needed funds, the Commission could achieve its zero infection target by 2030.
We are hoping that corporate Ghana, people in private lives, if ordinary Ghanaians who can afford it, can contribute to a fund, and with the fund we can help the people living with the virus in the terms of providing medication, providing things that prevent the virus being spread like condoms, providing lubricants, and then above all giving the medication on how to prevent the virus affecting you and then how to live positively with the virus. That's why we need the money to do all these things.
The Ghana Network of Persons Living with HIV and AIDS appealed to government to increase their quota of the District Assembly Common Fund. Emmanuel Sukuri is president of the network.
The government has allocated the 0.5 of the District Assembly Common Fund, but yet it is inadequate to enable the AIDS committees to move around the service centers. So we want to appeal to the government to increase from the 0.5 to 2% so that this can enable both the municipal and the district assembly to carry out their services, all to contribute to the national response.
Participants of the 2018 NACON also shared the expectations ahead of the conference.
Prevalence is rising. So at this conference, we want to see more of, more of not just promises, not just talks, but what will be factual, what will ensure that we will have funds to work with. So we want to hold government accountable, not just the government alone, but all duty bearers. So duty bearers, government want to hold them accountable for their promises, and then whatever is in line or whatever is in the pockets or in the coffers for us as CSOs to work with.
It is our hope that Ghana will start doing more. Already we are doing more in the field of HIV, but we are hoping that our leaders will start doing more. One of the key things at this conference is that we've started using artists to start talking about HIV. So at the community village, we will be having artists performing. Everybody can get infected at any time and anywhere. The most important thing is that we have things in place, commodities in place, ARTs, etc., and make sure that we are getting to undetectable stage.
Stakeholders are hopeful that the 4-day event would shed light on the challenges facing persons living with HIV and AIDS, and also outline strategies to achieve the 2030 zero infection target. Charity Emihil Bartels reporting for Joy News.
Charity, with that report there, let's have a very quick conversation on this. I have here in the studio with me Victor Atta Ntumi. He's the president of the Ghana HIV and AIDS Network. Mr. Ntumi, you're welcome.
Thank you.
I also have here in the studio with me Emmanuel Beluzep. Did I get it right?
Yes.
Right, he's the president of the NAPLAS. So we're talking about a radical approach, and you guys have given some suggestions there earlier already. Sometimes I'm wondering, there's a lot of work that has gone into HIV and AIDS campaign. So where did all the work that has been done go to if we're still seeing increasing rates of prevalence?
Thank you. You realize that this year's theme about the NACON conference, that's the National HIV and Research Conference, is ending AIDS and rethinking practice for maximum impact. So in this case, we are talking about impact, things that would inform the kind of strategies we will use to be able to bring down this HIV and AIDS menace. In that respect, there are a lot of intervention that have gone around. But then this time, Ghana has actually adopted a treat-all policy.
Treat-all policy?
A treat-all policy.
Okay.
What it means is that every person diagnosed HIV should be enrolled onto treatment and retained in care.
Okay.
What it means is that already we don't have a lot of resources to retain people in care.
So what it means is that there are people who have HIV,
yes,
but are not being treated.
Yes.
And those people are perhaps spreading?
Now, because of the policy, it means everybody that has been diagnosed should have access to treatment.
Now, this is very curious. I mean, how does a serious country that's looking to reduce the prevalence of HIV have people who have been diagnosed with HIV? The country is aware of it, aware of their status, and they are not treated. Yes. I mean, how does that happen? I don't know. NAPLAS, can you help?
Yeah, thank you very much. Just to continue from where he landed, I think your first question is how come?
Yes, I mean, with all the work and all the resources that has gone into it,
why are we still recording high prevalence? How come that is the worry that as the stakeholder together with you, the media, we all have a role to play to ensure this rethinking that we are talking about. It means that there's something that needs to be done. And that thing is not one person, it's a collective responsibility.
Okay, let me have you answer this. Oh, hold on for me. I think this is a very important part of the conversation that we need to have. How come there are people with diagnosis, people we are aware as a country of their HIV status, but they are not on treatment? How does that happen? Help me to understand that.
No, I wouldn't say they are not on treatment. I think what this policy is saying is that the UN, it is not only Ghana, it is the UN system that had come out with this target that come 2020, and 90% of people live with HIV. It means that come 2020, from now, last year, that 2015 up to 2020, 5-year period target, 90% of any person, whether you are aware of your status or not, at least Ghana should be working towards come 2020. Every person living with HIV should get to know his HIV status.
Is that the explanation? Because I don't quite get it that way. If you say operation treat all, please.
No,
let's get this explanation, because if I don't understand, then the probability that my audience doesn't understand is very high. So please, let's get the understanding.
What we are saying is that we have made significant progress.
Okay.
Formally, people are diagnosed, but they are still in transit, which means we don't have all the resources to give them treatment. This time we are saying that whoever, so that it is measured with your CD4 status before you are enrolled onto treatment. This time what we are saying is that the treatment is actually working. And the reason is that people must be enrolled onto treatment and they are kept in care.
I'm confused.
Let me make this clear to you.
Okay, please help me.
Let me make this clear to you. The system is worked this way. Before this 1990 agenda, what happened is that when a person is being diagnosed as HIV positive, you don't straight away put on treatment.
Okay.
You go through process. They monitor the state of your CD4, your viral load, how the virus has damaged your system that really need you to, because of the inadequate resources. Because at that stage, if they put everybody as a goal,
the system will break up because you can't sustain it.
Yes, we can't sustain it.
So how long does it usually take someone who has been diagnosed to
initially it started, your viral loads must fall below 150 at that time.
Okay.
You know, before you can be put on treatment. Because others can, if you have a very strong immune system, you can live with HIV virus without any signs or symptoms.
Okay.
And that means if the person will be, faithful, the persons can still live without any trouble.
Okay.
And for that matter, the fewer that are weak and already have a very low CD4 count,
they get to be put on the treatment.
They will put on the treatment for the meantime.
Okay, so now what we are looking to do differently.
So what we are now looking differently, because those who are strong and are not on treatment, but can easily also pass on the virus to other person. What the new policy is now target is that to bring all those people, put them once ago on treatment. And when all those people are put on treatment, it means their viral load will be suppressed. And they can no more transmit the virus to other people, to other persons.
Isn't it the reason why we are recording high prevalence now? Our inability as a country, because of resources, of course, to put people on treatment. Is that not the reason why we are recording this very bad statistics?
I will say to some extent, it may be no. What happened is that it's just a change of policy. You know, initially when the round 8 grant that came, that one was basically into education, right? And on education, the media were sponsors, civil societies that were giving some funds, NGOs were giving funds to run program all over across.
And that has also been a point of a bone of contention, really. People have contended that there were a lot of funds that was being pushed into the campaign, but really, did we monitor the funding and ensure that it was put to use, or it was used for what it was meant to be used for? Because it seems that a lot of money has gone in, but we're not getting the results.
If you had allowed me to learn, maybe you would have appreciated what I'm talking to you. So, you know, those funding, we can't say, well, we don't have the 100% system. But I can say that through that investment that was the civil societies, the NGOs, the CBOs, the media, and all that were put together to do the work, Ghana was significantly calmed down with the prevalence rates. But now the policy changed for the past, 5 years. And now the program now into treatment. And into treatment, most of the CBOs, the NGOs are not more funded. So information on HIV had become very normal. It's not, people are no more, talking about HIV.
So it's more about funding, not because people thought that, well, we've been able to deal with HIV.
Exactly. So because of that, we thought everybody is aware of HIV. But on the ground, people are rather affecting HIV ignorantly because information are no more flow as it used to be.
So what do we go from here?
That is why the current situation want to target, we want to rethink and get back to crash and see to it that this time we are not only targeting a fewer voluntarily, but we are targeting a 90% of our those who are living with HIV. So now, every now and then, Deva Community Festival, you see HIV screening is going on.
Okay.
And what it means is that we want by the end of 2020, at least the 90% of those people living with HIV in Ghana should know themselves. And knowing themselves, the government should be committed to provide, put the health system in place to ensure that the people who are diagnosed, put on treatment, have the access to treatment.
Okay, let me bring Mr. Nsumi in. Yeah. Mr. Nsumi, what's the way forward?
Yeah,
as we wrap
the
up
way
this
forward is that as we are saying that we have adopted a treat-all policy.
As in Ghana has adopted.
Yes, Ghana has adopted. CSOs are mobilizing themselves to promote community linkages and advocate for effective service delivery. Okay. That is one, because the person who is sick has a responsibility to go to the hospital and avail him or herself for treatment. And these are the things we should be doing. Then we are also saying that we should increase funding from government and our domestic sources. Because now that we are going to enroll everybody that has HIV on treatment, it means we are going to spend a lot more of resources to treating these people. And also mitigating the epidemic among the general populations by education. Because
is that not what we've been doing all along?
Yes, but we need
So why are we doing the same thing when we expect different results?
Yes, because we are expecting different results this time, because this treat-all policy, how many people know that now when you walk to a facility and you test and you are positive, you are enrolled onto treatment and you are retained into care? All these things need to be told. All these things need communities to be aware of. Yeah. And all communities should be aware that yes, Ghana has also adopted the fast-track targets of the 1990 fast-track targets by the UNS. And that is what we are working towards.
But you mentioned that one of the biggest issues has been funding. If funding is an issue, now that you're supposed to enroll everybody on a treatment program, and now you say that the funding has actually depleted, how are you going to sustain
globally
it?
Funding has not been adequate anywhere.
So how are we going to sustain this?
But we are saying that we are going to mobilize domestic resources. That is why it's critical to operationalize the AIDS fund, which has been passed, but then we need the ally to operationalize it. And once we all contribute into that fund, it means we will be able to sustain people who are enrolled onto care.
Okay, let me take your final words, Mr. Beluze.
Yes, just to add what your questions about this inadequacies. I think the 1990 agenda is something that a country that is not ready, you can't actually sign. It is an agreement, it is an MOU that the Ghana government agreed that he will be committed to ensure that funds are raised to support these services for us to achieve this 390.
So operationalizing the AIDS funds means putting some taxes on for people to pay. But whilst that's a very long process, and I can foresee that from here that this will take a while. In the meantime, are there any other alternatives, any other options apart from the collecting taxes?
Yes, we have to enhance the community collaboration. What it means is that there are a lot of things that we can do by engaging communities, even without not necessarily spending a lot of money. If we ask people to actually maintain a very healthy lifestyle, and for that reason, they are not under threat of HIV, it means we'll be winning some of the battle, and also the gains we have also made will not be eroded.
I don't know. I really hope that this works. I really hope that this works, and that the way I find it alarming that a disease that we thought we had dealt with, we thought that we had conquered, will still resurface in if government statistics as they're giving us is anything to go by, it seems to have worsened, isn't it?
It has not worsened.
But it says that the prevalence has gone up.
Yes, it's from 20, it's a cumulative figure from 2010.
From 2010.
From 2010. So what
but
we are
still
saying
putting
is that
a lot of work and a lot of resources.
Yes, but a lot has also gone on, and I think we are getting somewhere, because if you look at the cumulative prevalence rates in country, it is true that for some period now, some of the things are nosediving because of resource constraints. But then I don't think the situation is out of hand.
You don't think it's out of hand?
But let me just say that.
Okay, that will be your final word.
Yes. Let me just say that for the two of us, we are in the governance board, that being the what they call it, the immediate advisor to the government, what need to do to achieve this 1990, and we are the people that will really be on government to honor his part to ensure that this work. And I think for the look at things has already in place.
Things look good to
yes,
you say.
Things are already in place. I want to give the general, they should not panic. And these figures, let us be, you know, this is too technical. We should not look at, Ghana has actually come a long way. You know,
we need to wrap up with this, so
hardly for you to see people living with HIV. This time we are not talking about AIDS. We are only talking about people living with HIV. Mean that for now we have done with AIDS.
Okay.
So dealing with HIV is just something that all of us, if we are able to put our act together, come 2020, 2030, we should be ending issues about AIDS. We
all are hopeful of that. Victor Atta Ntumi is the president of the Ghana HIV and AIDS Network. Sir, thank you very much for coming.
Thank you.
And Emmanuel Beluzib is president of NAPLAS Ghana. By the way, what does your name mean? Beluzib?
Beluzib.
Beluzib. What does it mean?
Let them fight.
Let them fight?
Yes. No, not that. Let them, I see people are gossip about it.
Okay, so let them do whatever they want to do.
They should talk. That's my grandfather.
Beluzib.
Yes, they should talk.
And that's which language?
Dagari.
Dagari, I see. Interesting name. Thank you very much, gentlemen, for coming.